High blood pressure explained. From the experts. A video from the NASH Facts project, an organization committed to bringing you expert information from trusted sources about fatty liver disease and NASH. Enjoy the quick guide to high blood pressure, based on expert health information from the National Library of Medicine. What are other names for high blood pressure? High blood pressure is also called benign essential hypertension, HBP, HTN, and hypertension. What is blood pressure? Blood pressure is the force of your blood pushing against the walls of your arteries. Each time your heart beats, it pumps blood into the arteries. Your blood pressure is highest when your heart beats, pumping the blood. This is called systolic pressure. When your heart is at rest, between beats, your blood pressure falls. This is called diastolic pressure. Your blood pressure reading uses these two numbers. Usually, the systolic number comes before or above the diastolic number. For example, 120/80 means a systolic of 120 and a diastolic of 80. How is high blood pressure diagnosed? High blood pressure usually has no symptoms. So the only way to find out if you have it is to get regular blood pressure checks from your healthcare provider. Your provider will use a gauge, a stethoscope, or electronic sensor, and a blood pressure cuff. He or she will take 2 or more readings at separate appointments before making a diagnosis. You have high blood pressure if your readings show that your systolic is 140 or higher, or your diastolic is 90 or higher. Some providers may consider you to have high blood pressure if you have other heart risk factors, and your systolic is between 130 and 139, or your diastolic is between 80 and 89. Blood pressure readings above 180/120 are dangerously high and require immediate medical attention. For children and teens, the healthcare provider compares the blood pressure reading to what is normal for other kids who are the same age, height, and sex. What are the different types of high blood pressure? There are 2 main types of high blood pressure: primary and secondary high blood pressure. Primary, or essential, high blood pressure is the most common type of high blood pressure. For most people who get this kind of blood pressure, it develops over time as you get older. Secondary high blood pressure is caused by another medical condition or use of certain medicines. It usually gets better after you treat that condition or stop taking the medicines that are causing it. Why do you need to worry about high blood pressure? When your blood pressure stays high over time, it causes the heart to pump harder and work overtime, possibly leading to serious health problems, such as heart attack, stroke, heart failure, and kidney failure. What are the treatments for high blood pressure? Treatments for high blood pressure include heart-healthy lifestyle changes and medicines. You will work with your provider to come up with a treatment plan. It may include only the lifestyle changes. These changes, such as heart-healthy eating and exercise, can be very effective. But sometimes, the changes do not control or lower your high blood pressure. Then you may need to take medicine. There are different types of blood pressure medicines. Some people need to take more than one type. If your high blood pressure is caused by another medical condition or medicine, treating that condition or stopping the medicine may lower your blood pressure. The NASH Facts Project would like to thank Medline Plus from the National Library of Medicine. Medline Plus brings together authoritative health information from the National Library of Medicine, the National Institutes of Health and other government agencies, and health-related organizations. We would also like to thank the NIH National Heart, Lung, and Blood Institute, or NHLBI. The NHLBI is part of the U.S. Department of Health and Human Services National Institutes of Health, the nation's biomedical research agency that makes important scientific discoveries to improve health and save lives. This was High Blood Pressure Explained from the experts. Thank you for watching. Be sure to like this video and subscribe to our channel for more high quality, thoroughly researched, and medically reviewed content from trusted sources. And check us out on social